Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for a very long time. And over the last 5 months, as I've been releasing more and more videos in anatomy, I've had a constant feedback from students. Ma'am, why don't you help us also to solve MCQs besides teaching us anatomy in it? So I've come up with MCQs in the inguinal region. This is part 2 of this MCQ series. Please take a look at part 1 and part 3 to completely understand how to solve MCQs of the inguinal region. Let's begin. I'll quickly brush up the anatomy for you, so that helps you to solve MCQs easily. It's the best way of solving MCQs. Right. So let's talk about something called Hesselbach's triangle. Most of you never really understand it. It's very easy actually. Let's take a look. Ma'am, what is this? This is something you will understand once I explain it to you. So here are your two anterior superior iliac spines. This is your pubic symphysis. Come into the diagram now. ASIS, pubic symphysis. Here's your inguinal ligament extending in between. Okay. Now here is your median umbilical ligament, also called Urachus. And this is your rectus abdominis. Now are you able to understand where we are going? This is rectus abdominis muscle. Now you can see that there is a triangle formed laterally bound by this inferior epigastric artery, this one, okay? Medially bound by the lateral border of rectus abdominis muscle and inferiorly bound by the inguinal ligament. This triangle is called as the Hesselbach's triangle. Please revise with me. Laterally inferior epigastric artery, medially lateral border of rectus abdominis muscle and inferiorly inguinal ligament. This triangle is called the Hesselbach's triangle. Okay. It's divided into two by the obliterated umbilical artery. Might be asked sometimes. Okay. Point to remember is inguinal hernia, when it comes through Hesselbach's triangle, you call it a direct inguinal hernia. If it comes through the deep inguinal ring, then you call it an indirect inguinal hernia. Go back to the diagram. If it comes through the deep inguinal ring, it's indirect. But if it comes through the Hesselbach triangle, it is direct. Remember that. Hesselbach's triangle, direct. Deep inguinal ring, indirect. Okay? Right. So let's go and solve MCQs on this. A structure common to the Hesselbach and femoral triangle is conjoined tendon, inguinal ligament, inferior epigastric artery, rectus femoris. Close your eyes. Bring yourself back to Hesselbach triangle. This is it. Okay. So now you understand that extending from the anterior superior iliac spine downwards and from the pubic bone downwards, here is your adductor longus muscle, and therefore this is your femoral triangle. Okay. If this is your femoral triangle, and this is your Hesselbach's triangle, the structure common to both of them is your inguinal ligament. So now let's go back to our question. A structure common to Hesselbach and femoral triangle is it conjoined tendon? No. Is it inguinal ligament? Yes. Is it inferior epigastric artery? No. Rectus femoris? No. So you must be wondering, ma'am, if we already know the answer, why are we seeing the other two options? Sometimes it's better to check the other two options because it may be a trick. There may be some other correct answer and then you will have to come back to this one. Why did I think this was? It's always better to just quickly run through all the options given before giving in your answer, which in this case is B. Next MCQ, inferior epigastric artery lies dashed to Hesselbach triangle. Lateral, medial, anterior, posterior. This is your Hesselbach triangle. This is your inferior epigastric artery. You know the answer. It is lateral. A must be the answer. Absolutely. A is the answer. Right. During exploratory surgery of abdomen, herniation of bowel between lateral edge of rectus abdominis muscle, inguinal ligament and inferior epigastric artery was observed. Wait. Let's see. Lateral edge of rectus abdominis muscle here. Inguinal ligament here. Inferior epigastric artery here. So through basically Hesselbach triangle. These boundaries define the hernia as if a hernia comes through Hesselbach triangle, you know it is a direct inguinal hernia. Okay. Is it congenital? No. Direct or not congenital hernia. Very rare. Is it femoral hernia? No. Femoral hernia would have been below pubic tubercle, below inguinal ligament. Is it indirect inguinal hernia? No. It would have to come through the deep ring. Is it umbilical hernia? No. Umbilicus is way higher. Right? So it has to be direct inguinal hernia, which is a kind of hernia that comes through the Hesselbach triangle. It has to be direct. Let's take a look. B is the option. Okay? Knowledge makes you solve MCQs faster and easily. MCQ 4. A patient came with indirect inguinal hernia. Which of the following describes the condition? So which is correct? It is not contained within internal spermatic fascia. Not sure. It lies medial to inferior epigastric vessels. Remember, it's indirect. Indirect always lies lateral. Okay, indirect always lies lateral to inferior epigastric vessels. So this is wrong. It protrudes through deep inguinal ring. Yes. It protrudes through the Hesselbach triangle. No. Who protrudes through Hesselbach triangle? Always it's the direct inguinal hernia. So we were not sure about this. Ye kya hai? We were not sure. But we found that C is correct option. So every time you don't know everything about every option. But still you can mark the MCQ if you know your knowledge of anatomy. We know that indirect hernia always protrudes through the deep inguinal ring. And therefore C has to be the answer. You may or may not know what is internal spermatic fascia. Still, you got the MCQ right. Remember, if it's through deep inguinal ring, it is indirect hernia. If it's through Hesselbach's triangle, it is direct hernia. Some basics. Question 5. Which structure does not form a border of Hesselbach triangle? Revised borders of Hesselbach triangle. Lateral border of rectus abdominis, inferior epigastric artery, inguinal ligament. Lateral border of rectus abdominis, inferior epigastric artery, inguinal ligament. Now let's look at the options. Inferior epigastric does not. You're looking for a does not option. Wrong answer. Inferior epigastric artery forms border, inguinal ligament forms border, linea alba does not form border, rectus abdominis forms border. So C has to be the correct option. Yes, it is. Okay. MCQ 6. Following statements are true. You're looking for a correct option about the Hesselbach's triangle except it's bound medially by rectus abdominis muscle. Yes. By now we know the border, so we won't revise this, but you should think of it. It is bound inferiorly by inguinal ligament. Yes. It lies superficial to inguinal ligament. Not superficial, it lies superior. Let's see the last option. It is bound laterally by inferior epigastric artery. So, it has to be C. Medially, yes, it's bound by rectus abdominis muscle medially. It's bound by inferior epigastric artery laterally. It's bound below by the inguinal ligament. It is not superficial to inguinal ligament. It is bound, it is superior to inguinal ligament. Okay, so C is the incorrect answer. All the other are correct. Okay, so let's move on. So the next lot of MCQs, till now we solved MCQs on Hesselbach triangle related anatomy. 3 cord-like structures in anterior abdominal wall, peritoneal folds over them, fossae formed. This is something all of you have avoided in college years because it's just so complicated. Let's try and make it easy and solve MCQs. Remember some basics. In the posterior wall of inguinal canal lies the anterior abdominal wall. In this wall, you will find 3 cord-like structures, okay, 1 medial and 2 lateral. Each cord-like structure has got a name. Urachus, obliterated umbilical artery, inferior epigastric artery. Since they are lying up in the region of the umbilicus, pointing towards it, they're called as umbilical ligaments. Median umbilical ligament, medial umbilical ligament, and lateral umbilical ligament. When peritoneum comes in forms a fold over it, the folds are called umbilical folds. Which umbilical folds? Same name. Median umbilical fold, medial and lateral. Now this is all difficult to remember. Take a look at the image. You are sitting inside the patient's abdominal cavity and you are looking at the posterior part of the anterior abdominal wall. So, सामने urinary bladder दिख रहा है. So easy for you to orient. Here's the bladder and the anterior abdominal wall is showing you 1 and then 2, 3. In all, it's showing you 5 structures. What are these structures? In the midline, you are seeing Urachus or median umbilical ligament. Lateral to that, you are seeing obliterated umbilical artery or medial umbilical ligament. Lateral to that, you are seeing inferior epigastric artery or lateral umbilical ligament. Each is covered by peritoneum forming a fold, which are median umbilical fold, medial umbilical fold, and lateral umbilical fold. First thing you should remember. Now, because there are folds formed, there are fossae formed between folds. Between medial umbilical fold and medial umbilical fold, there is a fossa formed called supravesical or inguinal fossa. Between medial and lateral, the fossa is called medial inguinal fossa. And lateral to lateral, the fossa is called lateral inguinal fossa. Difficult to remember? Too much? Take a look. Okay, so here's your supravesical fossa between median and medial umbilical folds. Here's your medial inguinal fossa between medial and lateral umbilical fold. And here's your lateral inguinal fossa, lateral to the lateral umbilical fold. Revise this a couple of times, it's not that difficult. Now I'm going to show you something else. I'm sure you know what this is. Here you're seeing the fascia transversalis. Here you're seeing the external oblique, internal oblique, and so on. Okay. But in the posterior wall, this is your deep inguinal ring. This is your superficial inguinal ring. Okay. And this, my dear students, is inguinal canal. So look at this wall here. I want you to look at this wall here, which is showing you 1, 2, and 3 cord-like structures. This one in the midline is Urachus. This one next to it is obliterated umbilical artery, and this one next to it is inferior epigastric artery. As you can see, the peritoneum is forming folds over it. Each fold is having a name: median umbilical fold, medial umbilical fold, and lateral umbilical fold. And between folds are fossae. 1, 2, 3. 1 is supravesical fossa. 2 and 3 are medial and lateral inguinal fossae. Remember, supravesical fossa is also called as inguinal triangle. Okay. So this is something you have to remember. Maybe you can take some screenshots of this because MCQs are asked based on this. If a hernia develops passing through 1 or 2 coming forwards, you call that as a direct inguinal hernia. If a hernia develops passing through deep towards superficial inguinal ring, you call that as a indirect inguinal hernia. Got it? Direct from 1 and 2, indirect from 3 through deep inguinal ring. Right. So MCQs. During laparoscopic examination, what is laparoscopy? You put in a scope, you're observing the interior of the abdomen. So during laparoscopic examination of a young male patient, some interesting fact was observed by the surgeon. So the young resident assisting him was asked to look at the medial inguinal fossa. So think, where is medial inguinal fossa? There is one medial inguinal fossa, there is one lateral inguinal fossa. To see this region, she would have to look between what? Would she have to look between inferior epigastric artery and median inguinal ligament? Would she have to look between medial umbilical ligament and median umbilical ligament? Would she have to look between medial umbilical ligament and inferior epigastric artery? Lateral to inferior epigastric. See, lateral to inferior epigastric is lateral inguinal fossa. So this is wrong. Medial and inferior epigastric artery is where we should look. Medial umbilical ligament, median umbilical ligament would be supravesical fossa. Okay. And inferior epigastric and median inguinal ligament is too big a region. Let's see if we can understand this in the image. So, one would be supravesical fossa. The place where the resident was asked to look was medial inguinal fossa, which was between the medial umbilical fold and the lateral umbilical fold, or between obliterated umbilical artery and inferior epigastric artery. Okay. So, our correct option is point number C. These are complicated MCQs. You have to literally bring yourself into the image, look at that image in your mind and solve MCQs. Don't hurry into them. You are very likely to make mistakes. 62-year-old man gave history of lifting heavy weight and suddenly he felt pain in the inguinal region. Since then, he has experienced discomfort. He says he is never comfortable. He is examined and operated upon. During surgery, a hernial sac with intestine was found lying lateral to the inferior epigastric vessels above inguinal ligament. Lateral to inferior epigastric vessels above inguinal ligament. What lies lateral? Always indirect inguinal hernia lies lateral. What lies medial to inferior epigastric? Always direct inguinal hernia. So now we have something in our mind. The hernia was diagnosed as, was it incisional? There was no incision, so it's not incisional. Was it congenital? He's 62-year-old. Okay, so not likely to be congenital. Femoral, see, it's above inguinal ligament. Femoral hernia is always below inguinal ligament. So this is wrong. Direct inguinal hernia. Ma'am, it would be direct if it was medial to inferior epigastric artery. This is lateral to inferior epigastric artery. So it's not direct inguinal hernia also. So it has to be E, indirect inguinal hernia. Let's take a look. Yes, it is E. So use your knowledge to solve. Think, work at it. Okay. Incisional hernia, there is no incision. Congenital inguinal, he is 62. Even if it is congenital, it's rather late to call it that. Femoral hernia is always below inguinal ligament. Direct inguinal hernia is medial to inferior epigastric artery. And then finally, indirect inguinal hernia always lies lateral to inferior epigastric artery and above the inguinal ligament. Therefore, the correct option is point E. Let's go to MCQ 9. A loop of intestine protrudes through abdominal wall to form a direct inguinal hernia. So, in your mind, you are thinking medial to inferior epigastric artery. Viewed from the abdominal side, you are sitting in the abdomen. The hernial sac will be found in which region? You are sitting in the abdomen, you are seeing the posterior abdominal wall, okay, and you are calling it a direct inguinal hernia. So, would you see it at the deep inguinal ring? Never. If it's deep, it has to be indirect inguinal hernia. Would you see it in the medial inguinal fossa? Possible. Would you see it in lateral inguinal fossa? No, lateral inguinal fossa is always indirect inguinal hernia. Would you see it at superficial inguinal ring? Sitting inside, you can't see superficial inguinal ring, but it is therefore not this. It is likely to be medial inguinal fossa. Let's see if we are right. Here's an image, okay. It's a direct inguinal hernia. It's a direct inguinal hernia, so either one of these, okay. And my options are given here, okay. So it is not deep inguinal ring because it is not an indirect hernia. It's medial inguinal fossa possibly. It's not lateral inguinal fossa because lateral inguinal fossa is indirect. Superficial inguinal ring is lying here. Sitting inside, you can't see it. So it's likely to be medial inguinal fossa. Point number B. Yes, that is the correct option. With this, we've solved some rather difficult MCQs about a little complicated anatomy of inguinal region. But considering that we are fighting for post-graduation seats or for good marks, we need to really study the anatomy well. Let's now go on to muscle and fasciae which continue into inguinal canal. Okay, take a look. See, there was external oblique, there was internal oblique, there was fascia transversalis. Each of them gave rise to fascia which lined the inguinal canal. Most inside you find internal spermatic fascia, continuation of fascia transversalis. Outside you find external spermatic fascia, continuation of external oblique muscle. In between the two, you find cremastic fascia and muscle, continuation of internal oblique. Okay, so external continues as external spermatic, fascia transversalis continues as internal spermatic, and internal oblique continues as cremastic muscle and fascia. If there is muscle, there has to be nerve supply, genital branch of genitofemoral nerve. This is the anatomy you should remember. For your pleasure, I'm going to draw, make you see this. This is fascia transversalis. Beyond deep inguinal ring, it continues as internal spermatic fascia. This is internal oblique continuing as cremastic fascia. This is external oblique continuing as external spermatic fascia, and these are the rest of the layers. Okay, so let's solve. If the inguinal hernia is coming in this manner, direct, then it's not going to have internal spermatic fascia in its lining because it's never passing through deep inguinal ring. Okay, but if it comes in the form of an indirect inguinal hernia, it will have all three as coverings. So direct inguinal hernia will never have a cover of internal spermatic fascia because it does not pass through the deep inguinal ring. However, it can have a covering of fascia transversalis, conjoined tendon, reflected head of inguinal ligament, and so on. Fine. So let's solve some MCQs. In relation to direct and indirect inguinal hernia, which of the following statements is correct? So we are looking for one correct option. The direct inguinal hernia protrudes through the posterior wall of inguinal canal. I find this correct. It protrudes through the posterior wall. Idhar se. This is the posterior wall of inguinal canal here. So it's protruding through that. In general, indirect hernia lies more medially than direct hernia. No, indirect comes from here. It is more lateral. So this is wrong. Direct inguinal hernia follows the course of spermatic cord or round ligament through the deep ring. No, direct never enters the deep ring. Indirect inguinal hernia is always found below and medial to pubic tubercle. It is found above. It is found above. So this is also an incorrect MCQ. Therefore, the correct option has to be A. Let's take a look. Yes, it is. Okay. So this is how you solve your MCQs using knowledge. And of course, images are coming here. But in your exam, there won't be images. But you have to build the bank of images in your brain. Immediate structure anterior to direct hernial sac. Here's your direct hernial sac, this one. You can see lying anterior to it the external oblique, the internal oblique and its fascia, and fascia transversalis and internal spermatic fascia. But question is immediately anterior. Who is immediately anterior? Has to be fascia transversalis. External oblique aponeurosis is there. Internal oblique aponeurosis is also there. But the transversalis fascia is immediately anterior and therefore C has to be the option. Yes, it is. Okay. Let's go to MCQ 12. Fascia transversalis continues into the inguinal canal as the following fascia. You remember I told you. Okay. Fascia transversalis continues as internal spermatic fascia. External oblique continues as external spermatic fascia. Internal oblique continues as cremastic fascia. Peritoneum never continues as anything in the inguinal canal. So B is the option. Fascia transversalis continues as internal spermatic fascia. Let's go to, so this is the table I want you to remember. Fascia transversalis internal, external oblique external, internal oblique cremastric muscle and fascia, nerve supply of the muscle genital branch of genitofemoral nerve. Basic table. Following are true about the cremaster muscle except, remember cremaster muscle? It's a continuation of internal oblique muscle. Okay. Derived from internal oblique muscle, yes. It's an except, so you're looking for a wrong option. Okay. Pulls testes up towards superficial inguinal ring, yes. Its action is involuntary, yes. It is supplied by ilioinguinal nerve? No. It is supplied by what? Genital branch of genitofemoral nerve. Therefore, D is the incorrect option. Okay. So, basic knowledge, solve MCQs easily. MCQ 14. A 55-year-old male presented with a direct inguinal hernia. Direct yani it will be medial to the inferior epigastric artery. If the hernia extended through the superficial inguinal ring, it passed through, it would be surrounded by all the abdominal wall layers except. Now, I've already taught you this. Any direct hernia will never have a covering of internal spermatic fascia because it did not pass through the deep inguinal ring. Is there an internal spermatic fascia here? Yes. So, this has to be the answer. We'll read the others, but we know somewhere that one thing that cannot be a layer of covering the direct hernia, it is internal spermatic fascia. External may be. Peritoneum, extraperitoneal tissue, yes. Weakened conjoint tendon, definitely yes. Okay. So, you know that B is the correct option, internal spermatic fascia. Students, we've solved some rather difficult MCQs today using images. Okay. There is an earlier MCQ video made, which is Inguinal Region Part 1, and I will be making one more, MCQs of Inguinal Region Part 3. Please study all three to understand all possible MCQs in the inguinal region. There are, of course, lectures to make you understand the anatomy of inguinal region. Okay, so feel free to see those videos as well to brush up on your knowledge. The details of this are given in your description section. So students, keep studying and I'll see you in some other video. Bye.